It's physical torture, it's mental torture. You're literally coming undone at the seams. You're crawling out of your skin. I mean, you know, it's basically like you're living in hell. Back then, Oxycontin didn't have the same ring as heroin, nor do we have the knowledge that, you know, that little pill was going to lead me down a path of self-destruction. When we first started doing it, we were doing it on the weekends. We were doing it at parties. And slowly but surely, everything started centering around getting that pill every day, Monday through Sunday, a couple pills a day. And that went on for a long time. When you're high, like, your body is, everything feels normal, everything feels like, you know, it's exactly how it's supposed to be. You remove that drug and that chemical from your system, you know, your body just unravels. Anxiety kicks in when you don't have any money, when you don't have any source, when your dealers run out, you start going through these chaotic thoughts. You're just drenched in sweat. It's like all your bodily fluids are coming out of your body. Your stomach is twisted in knots. A lot of people end up puking. I wasn't really a puker when I was sick. I was more the person that, you know, violent diarrhea, pissing out your ass. Your bones ache. You know, they say flu-like symptoms. You know, it's pure agony. I remember, you know, I was dope sick off oxys, curled up like a baby, and I couldn't afford another pill. And, you know, somebody brought a bag of heroin to me. And at that point, it didn't matter what it was. I was so sick, I just didn't want to be sick.
If you get an acute pain, you know, you put your hand on a match or on a hot stove, it hurts like the blazes. And what do? You get cold water, you get some butter. It's relatively short-lasting. There are kinds of pain that are not.
Our job is really to educate and to prevent this problem from escalating.
Once a person starts with opioids, and there is a high from it, addiction is produced, and very, very quickly. And the person does not have control.
People need to be able to get into treatment as soon as they decide that that's the best option for them. Having a waiting period is really harmful to their health.
We know addiction is a disease. It is something that recurs. The drug hijacks the brain. It's a vicious cycle.
A Jacksonville Fire and Rescue Department transport unit is often the next step for somebody who's overdosed.
They're going to become extremely cyanotic due to the lack of breathing. They're going to be blue, unresponsive completely.
Jacksonville Rescue Division Chief David Castleman says first responders have been getting more calls about heroin.
Really, in January, we noticed that there was a marked increase in our responses to not only overdoses, but specifically heroin overdoses.
When paramedics respond to overdoses, they'll administer Narcan, a drug that reverses an overdose within minutes. Jacksonville's Fire and Rescue Department has used a lot of it this year.
From 2011 to 2015, we averaged between 200 and 300 administrations a year. In the last year alone, we've seen a 100% increase in the amount of Narcan that's been administered for these overdoses. But more importantly, since January up till now, in just this last 4 months, we have had a 278% increase in Narcan administration for overdoses.
Before last month, Narcan was only available on 41 rescue vehicles. Now, all the advanced life support engines carry it too. He says he'd like to expand that to every engine in the department.
Heroin use is sweeping the streets of Jacksonville. That, as the chief tells WJCT, in most of the fatal cases, heroin isn't the primary killer.
What's interesting about fentanyl is that it's 60 times more potent than heroin. It's a synthetic analgesic, and these drug users, or I should say drug manufacturers and dealers, they're cutting synthetic fentanyl with heroin, and so because it's cheaper to manufacture and it's much quicker to produce than heroin.
In hospitals, fentanyl is used for anesthesia, epidurals, and chronic pain, like for people who have cancer. Castleman says in Jacksonville, it's what's killing heroin users most often. The medical examiner's office contacted his department to let them know most deaths by heroin overdose were actually deaths by fentanyl.
We've had numerous cases that we responded to where the individual was using drugs alone, and we found them dead with the needle still in their arm. That's how quickly that drug acts.
He says most drug users don't know what they're getting isn't pure.
And so I think the message is, while we're not condoning drug use, is that if you are an addict and you are using illegal drugs, you should never use drugs alone.
For Community Thread, I'm Lindsay Kilbride.
I want to talk about the opioid crisis. It's a catastrophe. Everyone knows that. But there's a lot to it that you think you know that you actually don't. It's wrong. So I need you to bear with me for a minute whilst it's going to seem like I'm taking a detour here. But I have this solution, so bear with me. There's a herb called kratom. It's been used for decades, maybe centuries, over in Thailand. And it's being used here for decades, certainly. It's a painkiller, and it could be used to replace opioids. It's also not addictive, and it's kind of similar to coffee. In fact, it's in the coffee family. People are using it to break their opioid addictions, I'm sorry. And yet, the FDA keeps trying to get rid of it, to shut it down, to ban it. In fact, recently, the FDA just made a lie about it. They said kratom is an opioid, and it's not, because it doesn't come from opium. And they've been telling other lies about it too. Historically, meaning in the last couple of years, they've said that it's killed people. And you'll see that if you look it up online. But it hasn't. When you look at the people that they claim have been killed by kratom, instead you see people who've obviously died from other drugs, really dangerous drugs that they were using. Or in at least one case, the guy died because he hung himself. He simply had kratom in his system. Imagine how many deaths coffee would be blamed for if we attributed a person's death to coffee every time he had coffee in his system at the time of autopsy. That's how ridiculous it is. Kratom could help so many people. And like I said, it's already being used around the country. People take kratom and they're able to wean themselves off of these dangerous opiates. In other cases, they're able to simply relieve their pain, which is part of the core of the opiate epidemic, right? We actually have something of an epidemic of pain. We have had one. And that's why people are turning and embracing these drugs. No one's like, well, I just want to use these opiate drugs. That's not really happening. What's happening is they have pain and they want to get rid of it. And kratom could be that solution without the risks and without the mental effects. I mean, things like Vicodin can change the way that you think. They can muddle your mind so you can't drive or operate machinery. Okay. Now, how this ties in, well, it ties in a big way to the opioid crisis. You see, the FDA is a corrupt rogue agency. I know that's kind of hard to believe. I've been doing the health thing for 10 years, so I kind of take it for granted. But consider this. It costs $800 million on average for a new drug to be approved. That money doesn't come from us, the taxpayer, it comes from the drug company. And so in a very real sense, the FDA gets most of its money from the pharmaceutical complex, 97%. 3% of its funding comes from the government, which is from the taxpayer. That's it. So the FDA's job nowadays, its real job, is to protect that cartel that pays it. Now when it comes to the current opioid catastrophe, which is what we really have, we've got a lot of people who seem more innocent than what we think of when we think of druggies. Right? When you hear about someone who died as a result of, say, crack cocaine or heroin, there's some degree of sympathy in a lot of cases. But we know that the people who die or are addicted, they did so knowing what they were getting themselves into, at least knowing that that was a risk. At least knowing that when I'm shooting heroin into my arm, there's a good chance that something bad's going to happen if I keep doing it in the long term. I mean, we can at least say that at the basic. But the people who are hooked on opiates, that's not the case. In most cases, they started out by going to a doctor, telling him that he was in some degree of pain, being prescribed this, and not even being told that there was a chance that he could get addicted. Sure, that's changing, and that's a good thing. But certainly, a lot of people are addicted now to drugs that they would never even warned about. They just trusted that either entirely this drug is completely safe, or at this dosage, if I follow my doctor's instructions, everything will be fine, and that was a lie. It just wasn't true. So we've got doctor-made drug addicts. So these people are especially innocent, and that shows in the kind of public compassion for the victims. But and this is why the approach that I'm seeing kind of pushed in the collective narrative, if you will, of let's kill the drug dealers who are dealing these opiates is not going to work. Or even let's sentence them to ridiculously long sentences. There's a market there because people are suffering. And this whole thing was created by one bad policy after another. First you had doctors who were wantonly giving out really strong medications when it wasn't necessary. When like an ibuprofen would have done the job of prescribing a refillable prescription of Vicodin, for instance. And that's insane. And it was a bad policy. But the solution was kind of worse in the sense that we had the government who decided to come in and say, doctors can prescribe this drug, this amount, for this condition, and that's it, and if you don't, we'll prosecute you. And it required doctors to turn in their patients if they were doctor shopping. So it turned doctors into like a law enforcement division, and that's just kind of twisted. And doctors were afraid to give pain relief. So then you had people who had been addicted to these opiates, been addicted perhaps for years because maybe they had a car accident, a knee injury. It happens. And then they were told, you can't get the drug anymore because the government says that you can't have the drug anymore. And it's just cut off. You're an addict. Well, of course they're an addict. Been prescribed it for years. Or you have the new people. People who have serious injuries, who have serious pain, and they're not being prescribed the drug because doctors are afraid to prescribe it, even for legitimate reasons, because the government is there as the almighty hammer. it's a disastrous situation all around. It's a situation that was created by a bad doctor prescribing policy and then made far worse when the government came in to try and fix it. And what they did was they forced all of these people onto the streets. They created a black market. Because people have addictions and people have pain. And both of them need a way out. And in both of these cases, kratom can be a solution. But again, the FDA is rogue and they only really respond to extreme public pressure and pressure from Congress and so on. So the narrative is all wrong. There is a solution, a non-addictive, a fantastic solution. But the solution is not, let's crack down on these dealers because that's never going to work. It's a huge market. One that none of us would ever like to admit is as big as it is. But it's there as long as there are victims of pain. And this shouldn't even be understated. There are people killing themselves because they're in so much pain and the doctor won't prescribe it because he's afraid. If you like this video, please subscribe and hit the bell if you want to be notified of every new video we put out. We should be doing these, well, regularly. Thanks.
Health-wise.
The illicit use of heroin accounts for a large share of the health harms related to drug use in Europe. People who are dependent on heroin need to take it to avoid withdrawal symptoms such as panic, anxiety, muscle cramps and diarrhea. In the 1960s, 3 medical doctors suggested the use of synthetic opioids to stabilize users dependent on heroin, helping them to engage with treatment and work towards long-term recovery. Opioid substitution treatment, OST, is now the most common treatment for opioid dependence, with an accepted evidence base for helping to reduce both health and social problems. OST stabilizes brain neurochemistry by replacing the short-acting illicit drugs, like heroin, with medicines that have a longer-lasting effect, like methadone or buprenorphine. By taking regular, controlled doses of methadone, a heroin-dependent patient can reduce craving and withdrawal symptoms. Combined with psychosocial support, OST can help patients to stay in treatment and can reduce use of illicit drugs, mortality, and crime to obtain the drug. Although OST is considered safe and effective, precautions need to be taken to avoid the inappropriate use of these substitution drugs, the so-called diversion of OST drugs. Diversion can occur at all stages of the drug supply process, both voluntarily through sale or trade of the medicine, or involuntarily through loss or theft. Strategies to prevent diversion may target patients, prescribers, and treatment systems. In Europe, these strategies include application of evidence-based guidelines, registries, and medicine dispensers, and health education for physicians and patients. Opioid substitution treatment is a life-saving intervention, and ensuring the quality of its provision makes it safer and more effective.
Today, 4 more Massachusetts residents will die of overdoses, opioid overdoses. Over 80% of people that end up with a needle in their arm with heroin start with legally prescribed opioids. And there's only 2 things that happen with addiction, especially opioid addiction. Treatment, ongoing treatment, or death. And more people will die this year from opioid overdoses than car accidents.
the word that I have trouble getting out is hopelessness. These kids don't have any hope. They're trapped. They're trapped by their addictions.
Those studies that look at adverse early childhood experiences and long-term mental and physical health, one of the adverse childhood experiences that is clearly associated with a poor outcome is having a parent or guardian with a significant substance problem.
So working with organizations like the Cambridge Health Alliance is a step in the right direction, and sometimes through that step you can enter a space where you can find hope for these kids.
Stigma is, I think it really hinders a lot of people from getting help, from saying that they even have an addiction.
In 2014, the last year we passed a gun bill, I got to know a chief of police from Gloucester, where I spent a lot of time, and he was very helpful in our getting our gun bill passed. And I had said to him, if there's anything you ever need, let me know. And then last spring, he announced that starting on June 1st, anyone with the disease of addiction could come into the Gloucester Police Department, not be shamed, not be judged, and be helped into treatment, not jail. And he took this very bold stance for a police chief to say this is a disease, not a crime. It needs treatment, not jail. And in the absence of treatment, of ways into treatment, he was going to provide that through the Gloucester Police Department. So since June 1st, 2015, over 400 people have come into the Gloucester Police Department, and all are in treatment. Over 100 police departments across the country have partnered with us. Over 200 treatment centers have partnered with us, providing beds for treatment with or without insurance, scholarships if people didn't have the right kind of insurance, and we have another 100 police departments lining up. We've worked with Governor Baker and passed comprehensive opioid addiction and treatment legislation, and we're working with the U.S. Congress because, frankly, whether you're Mitch McConnell from Lexington, Kentucky, or Ed Markey from Lexington, Mass., your constituents have the same problems. This disease knows no boundaries.
The most important thing for me is humility and being willing to surrender and practicing that in my life. I have to remain open-minded and listen to what different people are saying. And those are some of the things that I've heard over the years that I always fought them. I always thought I could trust my own thinking and I knew what was best. And that doesn't mean I'm not intellectually competent to make decisions in life. It just means that I don't have all the answers. And I had to arrive at a place where I was willing to take some advice from other people. And from being around 12-step recovery for years and years and years and constantly hearing them say, you have to do all this stuff, I would go to these meetings and hear them say all that, and then I would say, well, I'll do this, this, and this. And that will work for me because I'm different than everyone else. And I'll figure out the rest. And I would go back and I would use. And so through trial and error, I finally said, you know what, I gotta just try this. I gotta listen to what they're saying. But it wasn't just a 12-step program either. It was going into therapy. That's why, I mentioned that, because I knew I needed to sort through some of that stuff. The loss of my father, active addiction in the home, multiple losses of friends and family members throughout the years that I never even processed.
So for me, recovery is, I've changed a lot. I've changed my behaviors. I don't use drugs or alcohol in any form. So, there's some people who are on the harm reduction side. I'm completely abstinent from all drugs and alcohol. And it wasn't until somebody said to me that exactly what you said, you don't look like a drug addict. And I was like, wait a minute, I'm not a drug addict. I am a mother. I am, you know, employable. I started feeling like this doesn't have to be my whole life.
This isn't me.
This isn't me,
right.
you know, and it was like a spiritual awakening. And
It's like a revelation.
it was, because I had kind of resigned, like, I'm just always gonna be this. I'm always gonna be an addict. I'm always gonna just be, it's gonna just get worse. And it didn't have to be, and I started waking up, and, you know, I just haven't stopped since.
We need programs that can have the sustainability to really work long-term and have patients meeting with outpatient recovery coaches and therapists and counselors on a twice, 3-time weekly basis for weeks, months, years as needed.
What keeps you in recovery? What would you tell her?
My children.
Your children. Simple answer.
Yeah, my children.
How many do you have?
I have 3 children.
Oh, lucky kids.
Yeah, they're awesome. They keep me on my toes. My daughter's 11. I have a son who's 9, and then I have a 7-year-old.
And you have your hands full.
I do. But I came into recovery for myself, but they have really, and my mother too, they are my inspiration. They're why I work hard. They're why I want to go back to school and why I stay in recovery.
We need to stop the shaming. We need to address this crisis, this epidemic, as what it is. It's a chronic disease with no cure that needs to be treated long term. And once we do that, we'll get a handle on the 47,000 overdose deaths a year.
I see very, very few people overcoming this addiction.
Pike Commonwealth's attorney Rick Bartley has dealt with countless drug cases, and now many of those cases involve methamphetamine. It's an epidemic Bartley and local law enforcement have dreaded for years.
Prescription pill addiction, when we were facing it, I thought was the worst thing coming and going. But prosecutor friends of mine from downstate said, wait till meth hits you and you'll be singing a new tune. And unfortunately, I think they're right.
And meth case among meth case continues to be brought before the Pike County Grand Jury, including 2 new ones last week.
We indicted 2 people this week for relatively small amounts of meth, but both of them had other pending cases involving meth here in the Pike Circuit Court.
According to the separate unrelated indictments, 32-year-old Bruce Jett and 33-year-old Amy Hilton were indicted on first-degree possession charges for allegedly being found by Pikeville police in separate incidents to be in possession of methamphetamine. Bartley said the meth epidemic the area is now experiencing is destructive on a level not seen previously, even with prescription painkiller addiction.
This meth addiction is just so powerful that I see very, very few people overcoming this addiction. And the problem with it is it develops very quickly. Just within a week or so of using meth, they're addicted to the point that they'll do anything, give up their families, commit any kind of crime to feed the addiction for meth.
Bartley said his experience with meth cases so far has painted a bleak picture for those addicted to the drug.
People that get started on it don't quit until they die, or until we lock them up.
Persons such as Amy Hilton and Bruce Jett, allegedly found with meth, could face 5 years in prison for possession of the drug. And with the ease of making and obtaining meth, the problem is likely to get worse.
It's like nothing I've ever seen.
Reporting in Pike County for EKB News, I'm Chris Anderson.
So what are the effects of the drugs on the body? There's drugs effects on the body and body effects on the drugs. What is the high like? Is it a stimulant sort of high? Is it a depressant sort of high where they get relaxed and calm down? What receptors does it attach to? Which neurotransmitters? Is it dopamine? Is it serotonin? Is it norepinephrine? Is it all of the above? What physiological effects? So is it affecting just the brain? Probably not. It's also going to affect the heart, the lungs, the kidney, certainly the liver, because just about everything goes through the liver at some point in time or another. What psychobehavioral effects will it have? What are the consequences of what it's doing to the brain? What is the initial state of the brain like before it gets in there? How is that going to affect it? What interactions will it have with other drugs and medications? Are they working in the same way, or are they contradicting each other? I have a couple more slides about that in a minute. What happens if you overdose? How many people know what an opiate depressant overdose looks like? It's a very, get the nod at first, and it slows down. It's a depressant, meaning that not necessarily it causes depression, but it depresses function. So first it's going to depress consciousness, so people will eventually go unconscious. Then you'll notice that their breathing gets shallower and slower, because eventually what it's doing is it's shutting down all parts of the brain, and eventually it shuts down the part of the brain that reminds the lungs to breathe. And that's when you get into problems, and people go into respiratory failure, and then their heart stops. But it's the respiratory failure that is what's the direct effect of the drug. Stimulant overdose. How many people have seen stimulant overdoses? Yeah, those are a lot more unpredictable. You can get a psychotic reaction. Someone just hits too many brain chemicals going, and they become psychotic and delusional and very agitated and activated. It affects body temperature, so you're going to get people overheating. Affects everywhere that there's a blood vessel, because what stimulants do is they constrict the blood vessels. So everywhere that there's a blood vessel, it's going to affect. So it's going to increase blood pressure, increase heart rate. Eventually, what can happen is a seizure. You just get all that activity in the brain, and it becomes too much for the brain, and the brain goes, okay, that's enough. Seizure, done. But it's the overheating and the seizures and the heart effects is what's going to be the problem with the stimulant overdose. Overdose with hallucinogens. Surprisingly, not that much in terms of physical effects. They can have a lot of psychological effects. People can have a bad trip. People can really get very anxious about how out of control they're feeling and all of the stimulus that's going on and stuff like that. They can put themselves in dangerous situations. But the actual overdose effects, it doesn't really affect so much the other organs of the body, so there's not usually a dangerous overdose per se. Withdrawal. The opposite of overdose. What happens with withdrawal? That can also be very dangerous. Surprisingly, overdose with opioids, not that dangerous. People think they're dying. They feel like they're dying, but they're probably not going to. There are flu-like symptoms, diarrhea, chills, nausea, muscle aching. It's a horrible, horrible withdrawal, but it's rarely fatal. What's the most dangerous thing to withdraw from? Alcohol. Yes, alcohol is the most dangerous thing to withdraw from. Benzodiazepines can be a close second because the benzodiazepine and all the PAMs, they change the seizure threshold in the brain. They're actually used to treat seizures sometimes. So that raises what the brain needs to do for a seizure. And if you take that away suddenly, someone can have a seizure. With alcohol, people can get seizures. They get swelling on the brain. They can get permanent brain damage from it. But they also can die from alcohol withdrawal. Not from just a big bender. This is we're talking someone who's drinking a lot all the time. But that is the most dangerous kind of overdose. So what we usually do, withdrawal. What we usually do with that is bring someone into a medical detox. And remember how I said if they have a tolerance to alcohol, they have a big tolerance to Valium. So we actually load them up with Valium to try and get rid of some of the effects. We give them some vitamin B1 and some thiamine, and we try and stop some of the brain damage from happening, and then we taper them off slowly. More effects of drugs on the body. Why we're getting high, the neurotransmitters, the receptors, something called reuptake pumps, which lets more brain chemical be available. So that's drugs on the body. But we can't forget about what the body is doing to the drugs as well. This has a lot of ramifications. So the effects of drugs on the body is called pharmacodynamics. Effect of the body on drugs is called pharmacokinetics. This is getting the drugs in. So we've got the route of administration. Route of administration can be everything from intravenous, which is the quickest, of course. Very close second is inhaling or snorting. There's oral ingestion. There's also rectal ingestion, which gets similar results to oral ingestion. So how the drug gets in affects sometimes how quickly the rush is and how quickly the peak is. The quicker the rush or peak, the more likely it is to be addictive. And getting the drugs in is a lot of where the harms come from. Of course, we know all the harms with intravenous drug use, but we also see with inhaled drug use, there's problems with the lungs. We see a lot of problems sometimes with nasal drug use. That people will get problems with the cartilage and problems with the mucous membranes, and a lot of, if they're crushing things and trying to snort them, that's very abrasive, and so you can get a lot of problems with that as well. Even oral administration, people, if they're sharing straws or sharing drinks and stuff like that, and they have open sores or cuts on their lips or around their mouth, that it can be a way to transmit disease as well. Getting the drugs around, mostly through the blood system. Getting the drugs out, most of them go through the liver. There's very few drugs that don't go through the liver at some point. And what the liver does, it tries to inactivate the drug. Sometimes the first time through the liver, it actually activates the drug even more. So this is when we get some drugs that have a longer lasting effect. Then it goes through and becomes inactive. Might go through the liver again. Some things go through the liver 3 or 4 times, like Valium goes through the liver 3 or 4 times before it works its way out. How long do drugs last? The half-life. Has anybody heard the term half-life? Half-life is how long it takes for the drug to get from its peak, or 100%, down to 50%. Now, it doesn't go, though, from 100 to 50, 50 to 0. It goes from 100 to 50, 50 to 25, 25 to 12.5, 12.5 to 6.25, and so forth. By that math, it never actually reaches 0, but practically speaking, 5 half-lives is how long it takes for a drug to get out of the body. Half-life can also be an indicator of how addictive something is. Something with a shorter half-life can be quite addictive because it's out of the body quicker, the body goes into withdrawal quicker. So nicotine is the classic example of something with a very short half-life, that people need it very quickly after they've had some, and it gets out of the system. Other effects of the body on drugs, interactions. Sometimes the interactions are how the drugs are working, but sometimes it's interactions at the site of the liver. Sometimes one drug keeps the liver too busy, so the second drug comes along and it can't be metabolized. So it actually sticks around in the body later because it's waiting for its turn to go through the liver. Sometimes the liver can speed things up too, but usually it is that one drug blocks another drug from going through the liver. That's how grapefruit juice, if you ever heard that grapefruit juice interacts with medications, grapefruit juice blocks one of the enzymes in the liver that other drugs go through, so that they actually have to wait their turn to get processed. Adaptation, tolerance, and withdrawal. This is all things that happen in the brain slowly over time. Happens at different rates with different drugs, and different amounts with different people, and depending on their physiology and how much they've had and so forth. So don't forget about the other parts of the body besides the brain. That's mostly what we're talking about with these. Anything called psychotropic or psychoactive is something that's acting in the brain. But most things have some effect on the heart, kidneys, liver especially, brain. It has effects on body temperature, blood pressure, and heart rate. But, the ones that actually affect more organs are the stimulants. And that's what we really worry about with these research chemicals, is we don't know how much of an effect it's having. on all of these systems. One thing seems for certain is that a lot of them seem to have seizures and overheating as a big consequence of them.